Well, that day, I was at work, my husband was at work, and my daughter was off school that day. She called me and she's like, "When's Bubba gonna be home?" Because that's what we call him. And when I call him, he normally either picks up right away or calls me right back, which he did not. So just motherly instinct kicked in, and I thought something's not right, because he had stayed the night at a friend's house. My husband's a Marine. He doesn't really show emotion or anything, but I could tell in his voice, he said, "I need that boy's phone number now. I need to know where he lives now. Something's not right." Somebody had actually dialed Cody's dad's number and put the phone up to his ear, and all my husband heard was like just garbled sound. "Your son's incoherent. I want to call 911.
My colleague got a call first that Cody had suffered a large left brain stroke. He was beyond all of the standard stroke therapies that an outside community hospital and/or primary stroke center could offer. Within an hour of hospital arrival, he was taken to the operating room where he underwent a hemicraniectomy enduroplasty. That's removal of the skull and stretching the lining over the surface of the brain. And that was done for life-saving measures and to hopefully minimize brain swelling and mass effect. He was placed on hypothermia, where his brain and body were cooled down to approximately 33 degrees. And that cooling was sustained for a few days. And the most unique thing about that is on the follow-up brain scans done several days later, there was only mild swelling and mass effect, so we couldn't have asked for better as to the goals of those initial two therapies.
Had they not done the craniotomy, the possibility of, well, probably more than a possibility, that the swelling would have gone down onto his brainstem and he would have died.
I said, "I love you," quietly. That's it, but Mom cried.
I think if anybody has a loved one who goes through something like this, I definitely would recommend them coming to Hershey, because they are just really, seems like cutting edge, and I would strongly recommend Dr. Reichwein, because he really thinks outside the box, and he doesn't act like it's a job.
Stroke can affect anyone at any age, so nobody is immune to stroke. Many young individuals have similar risks to older individuals, and the classic risk factors are high blood pressure, diabetes, high cholesterol, smoking, alcohol abuse.
I never suspected a stroke. I don't think I knew really anything about a stroke, to be honest with you. I'm probably like, a lot of people, you might use that word, and I hear people all the time using the word heart attack and stroke interchangeably, and knowing now that they're not the same thing.
A stroke and a heart attack are very similar in that they're vascular events, but a heart attack will give you chest pain. So often, since stroke doesn't hurt, it's very tempting for people to wait for the symptoms to go away, and that's the worst thing you can do. You need to call 911. There's a lot of different symptoms. A simple way to remember them is by remembering the word FAST. This is a FAST criteria. It means face, arm, speech, time, F-A-S-T.
Cody was deemed bad coming through the door. We threw in the kitchen sink and the refrigerator. This is why I'm here, because at the end of the day, we took an individual who otherwise would have certainly died and gave him a new lease on life. And from my perspective at a stroke center, I consider ourselves the future, and for our patients, the future is now.
Thank you for helping me and save my life.